Good morning. My name is Greta Johnson, and I'm the Director of Communications and Assistant Chief of Staff for the Summit County Executive's Office. On behalf of the Executive, we extend our condolences to the family of Jasmine Tucker, as well as all members of the community who are struggling or overwhelmed by recent events. The Summit County Medical Examiner's Office is one of 9 departments within the County Executive's Office. Summit County is unique in that it employs the expertise of a medical examiner and not a coroner. It is important to note the difference between a medical examiner and a coroner. The titles are not interchangeable. A coroner is an elected lay person who does not always have professional forensic training. A medical examiner is appointed and has board certification in a medical specialty. The Summit County Medical Examiner's Office employs 3 full-time doctors and additional staff. The Medical Examiner's Office is independent from law enforcement agencies, and the work completed by the Medical Examiner's Office is the documentation of autopsy findings and investigation of circumstances related to the cause and manner of death of an individual. During the course of an autopsy examination, evidence related to the cause and manner of death is collected and secured so that it is available for any potential future legal proceedings. All of Summit County's doctors are forensic pathologists who have undergone training specific to determining the cause and manner of death and the collection and preservation of evidence for use in these legal proceedings. The autopsy of Jasmine Tucker was performed by Chief Deputy Medical Examiner Dr. Robert Schott. The final report was created by Dr. Schott and contains the examination findings. Summit County's Chief Medical Examiner, Dr. Lisa Kohler, completed a quality control review of the report and then co-signed the report, as is customary. This process of quality control report review takes place for all homicide deaths prior to the report being finalized. As it is with every investigation, the goal of the Summit County Medical Examiner's Office is to be able to provide an accurate assessment of the injuries sustained. The Ohio Revised Code is clear that the press is entitled to review the autopsy report, and as stated in our advisory, we have put into place a system by which members of the press can make an appointment to review the report. Because of the number of requests received to review the report, it was clear that relaying a summary of the autopsy findings to all of you was a more expeditious manner of ensuring that accurate information is disseminated. Today you will hear from Chief Medical Examiner Dr. Lisa Kohler, who will provide a summary of those injuries sustained by Mr. Tucker, as well as some of the findings determined as a result of the autopsy. Dr. Kohler joined the Medical Examiner's Office in 1998 and has been Summit County's Chief Medical Examiner since 2001. She received her Doctor of Medicine from the Medical College of Ohio at Toledo. She completed a pathology residence at the University of Pittsburgh Medical Center and completed her forensic pathology fellowship with the Chief Medical Examiner of Richmond, Virginia. She is board certified in anatomic and clinical pathology and forensic pathology. In addition to her duties as medical examiner, Dr. Kohler teaches as an assistant professor of pathology at Northeastern Ohio University College of Medicine. She is an expert witness in the states of Ohio, Pennsylvania, and Virginia. Her office maintains full accreditation with the National Association of Medical Examiners. At this time, I'd like to call Dr. Kohler to the podium.
Thank you, Greta. Good morning. I would also like to offer my condolences to the family and friends of Jasmine Tucker. Jasmine Tucker's autopsy was performed by Dr. Schott on November 29, 2024. Dr. Schott then created a report of findings that I later reviewed for quality control purposes. I co-signed that report on January 14th of 2025. The first part of the examination involves documenting identifying characteristics and noting medical therapies and injuries. Evidence of medical therapies included an endotracheal tube or breathing tube in his mouth, vascular access lines in the bones of his right shoulder and right lower leg, that's his left shoulder and right lower leg, a chest seal over a wound on his back, which is used to prevent air leakage from the lung cavities, a thoracostomy incision on the right and left chest, which are surgical incisions that allow treatment for the lungs, a sutured thoracotomy incision on the left chest, which is a surgical incision to treat the lung, and IV access in the right wrist to allow administration of fluids. The autopsy examination determined that Jasmir had 3 gunshot wounds. These injuries include the following. 2 gunshot wounds injured his torso and 1 injured his right arm. It's not known what order these wounds were inflicted or what position Jasmir was in at the time the wounds were inflicted. 1 wound entered the left mid-back and injured the spleen, stomach, diaphragm, left lung, and heart. That bullet exited the left lower chest. The wound was associated with bleeding into the chest cavity and into the abdominal cavity. A second wound entered the lower back just to the right of his spine and injured the small intestines and the abdominal wall. This bullet was recovered from the tissues of the abdominal wall just below the belly button area. The wound was associated with bleeding into the abdomen and lacerations of the small intestine. A third wound involved the right upper arm. This wound injured the muscle only. The arm bone and major vessel in the upper arm were not injured. The wound characteristics were not specific enough for us to indicate which wound was an entrance and which was an exit in that arm, and no bullet was recovered from that wound. Jasmir had no other significant traumatic injuries, and he had no significant medical diseases. Toxicology was positive for a marijuana metabolite in his blood. The cause of death ruling in this case was gunshot wounds to the torso. Cause of death describes the injury or the illness that results in the death of an individual. The manner of death was ruled homicide, shot by another. Our ruling of homicide is a medical conclusion. It is not a legal conclusion. It means death at the hands of another. The manner of death describes the circumstances surrounding the death of an individual, and we have 5 different choices there. The first would be natural, which is due to natural disease, such as an infection, heart disease, or cancer. The second is accident, which is due to injury or poisoning that was not intended to cause harm. Suicide is an injury or a poisoning that was inflicted with the intent to cause self-harm or death. Homicide is just death at the hands of another. Undetermined is used when we don't have an ability to separate 2 competing manners of death based upon our investigation and our examination. I understand that there have been questions raised regarding the performance of gunshot residue testing. First, allow me to explain what gunshot residue testing is and some additional information regarding the testing. Although the technology used to demonstrate the presence or absence of gunshot residues is sound, there are many factors that contribute to false positives or false negative results. Gunshot residue testing can detect specific particles related to the discharge of a firearm, but the results of such testing are not conclusive as to whether an individual did in fact fire a weapon. The particles are very fine and easily dislodged from the skin by acts as simple as putting one's hands into one's pockets or even by sweating. A positive test does not indicate that a person fired a weapon. A negative test does not mean that the person tested did not fire a weapon or was not in the vicinity of a weapon. The FBI discontinued their gunshot residue testing in 2006. Based upon the issues related to the interpretation of the testing and the ease with which particles can be dislodged from the skin, the medical examiner's office discontinued collecting these samples in 2016, and we no longer purchase the collection kits for use by my staff. Because of this, Jasmir Tucker's hands were not swabbed and were not tested for gunshot residue testing. Upon my co-signing of the report, members of the executive staff provided the report to Jasmir Tucker's family by way of their attorney, as was requested prior to this media announcement.
At this time, we will take a limited number of questions. Please be aware that Dr. Kohler will not, excuse me, Dr. Kohler will not speculate, and we will not comment on the ongoing investigation that's being completed by BCI. Bob?
Dr. Kohler, are you able to tell which gunshot was fatal and if any
Okay, with regards to the lethal wounds, both of the wounds to the torso are lethal. The first one that I described that injured his heart and lungs would be more rapidly lethal. And with regards to rendering aid, because the heart was damaged by the gunshot wound injury, more rapid aid would not have changed the course of events here.
Other questions? Stephanie?
So, Dr. Kohler, you said that you weren't able to determine which way he was when he was shot, but how is he lying when they got to him? Are you able to say anything about the direction of the shots at all?
We are not able to indicate what position he was in at the time he was shot, or when we're going through the direction of the wounds. That is based as though he were standing in anatomic position, upright with his hands down to his side. We don't make assumptions as regards to the positioning of him versus someone else, and we don't have that additional information at this time.
Yes, ma'am.
Do you know how quickly he died?
We don't have knowledge of how quickly he died. The wound to his heart would have been very devastating, and it would have been rapid.
Other questions?
Are all three shots from the same firearm?
We don't have that information.
I don't know if this is redundant to what Stephanie asked, but based on what you know and the video that's been out there, does it appear he was shot while he was running away?
We don't have that information.
And is it possible, or do you know that sometimes you can be shot in one part of the body can be moved, and then you can be shot on the opposite side? Or can you tell them that?
She's not going to speculate on that. Anything else?
Can you comment on the volume of blood, how much he may have bled out?
We don't know how much blood was lost. There was a small amount of blood in the cavities, but he had also undergone medical therapies, which would allow some of that blood to drain out, so we do not know.
Yes.
Are you able to tell what caliber bullet was used, or what type of bullet was used to kill him?
There was one bullet that was recovered from his body, and it was a small caliber.
For clarification, was he pronounced dead at the scene or at the hospital? Because you said it might have been devastating and potentially quick.
He was pronounced at the hospital.
So was he still alive on the way to the hospital?
He was pronounced deceased at the hospital.
Stephanie?
You said small caliber. Are you able to give, more pronounced definition of what kind of bullet was recovered?
We do not analyze the bullet itself. It's just by looking at it, it was described as a small caliber.
So just to confirm, you said more rapid aid would not have changed the course of the events, meaning it would have been fatal regardless?
Yes, ma'am.
All right, thank you all for being here today. As stated in our press advisory, if you have submitted a written request to review the autopsy report, you can do so by making an appointment with the medical examiner's office and reviewing that in their office during regular office hours. Thank you all for being here today.